morning. It looks like you're a little low in the bed. We're going to need to help you to move up. Are you able to scoot yourself up in the bed? Okay, I'm going to grab a friend here and we're going to assist you up in the bed. We're going to keep good body mechanics the whole time. We're going to take these rails down. I'm going to squat a bit so that I'm in good posture while I'm working with the lower bed. You're going to feel your head moving down. And then we're going to lift the bed up to a good working position for the shorter of the two people that are assisting. Okay, these are right about hip height. If you could bend your knees for me. Okay, you and I are going to squat like so, with the back straight, good strong posture. You're going to put your hands across your chest like this.
We're going to remove the pillow too. There we go.
Very good. We're going to support her at the hips and the shoulders primarily. We're going to start with the weight on the back foot and then lunge into the front foot, and we're going to move her up about a foot.
Okay.
Have good strong grip here. Are you ready? On three.
One, two, three.
Good. Are you comfortable? Very good.
Much better.
I'm going to squat again. I'm going to elevate her head and get her comfortable. We're going to move the bed back down to patient level.
Put the pillow under your head while he's doing that.
Are you in a good spot?
Yes, thank you so much.
Fantastic.
You're welcome.
Here's the rails. You're all set.
Thank you, guys.
You're welcome. Hello, ma'am. It looks like we're going to need to help you to roll. Okay. To make this work properly, we're going to bring the bed up to working height for my friend and I. You're going to feel your head moving down, and you have to make sure the knees are flat as well. Okay, we're going to make sure the patient has enough space to roll towards me this time by shifting her a bit to her right. Okay, so you're going to put your hands across your chest. That's good. We're going to take the pad like this. You're going to need to keep your back straight and get in a good strong stance there. I'm going to be in more of a lunge, and we're just going to move her over an inch or so just to make sure that she has space. I'm going to be pushing, and you are pulling. On three, and go. Good. You're pulling, I'm pushing. There we go. All right, now in order to roll properly, you're going to bend that knee. Very good. For my part, I'm going to work from the hips and the shoulders. That's where the weight primarily is. I'm going to, again, be in a lunge position. I'm going to here and here, keep my back as straight as possible. I'm going to be pulling. She's going to be pushing on three. 1, 2, 3. To sideline.
Doing a skin assessment, and skin looks good. And
Okay.
roll her back.
Now we're going to return to her on her back. I'm going to push. She's going to pull. And here we go. Very good. And return her to a position of comfort. You did great.
Thanks.
Hello. We're going to help you move from this bed to this chair. We're going to do it in a safe manner. The first thing that I'm going to do is move the bed up to working height. That should be about a hip level. Okay. What we're going to do is we're going to be rolling to side lying together, and then we're going to be coming up to seated on the edge of the bed. We're going to make sure you're okay. Then we're going to use a safety belt at that point and make sure that your feet are on the floor, and then we're going to help you to stand and rotate and sit in the chair. I'll continue to explain as we go. Okay. So the first thing that we need to do, I need you to bend this knee here. Good. So I'm going to help you to roll on your side a bit there. I'm working at the hips and the shoulders. I'm in a lunge position to maintain my body mechanics. We're going to roll. Good. She's going to remain like this. We're going to make sure that we have enough space on the edge of the bed. I'm going to help her to bend both knees and bring these off the edge of the bed. When it's time to push, you're going to push with this elbow and this hand. If the patient needs assistance, I'm going to put my hand on the hip as well as the shoulder blade. We're going to count to 3. I'm in a good strong position with the straight back. On 3, we're going to push. 1, 2, 3, push and up. My hands on both shoulders, make sure she's taken care of. Are you feeling fine?
Yes.
Very good. I'm going to keep one hand on the patient, and I'm going to go ahead and lower the bed on down in the squat. Okay. We're going to use a safety belt today to help you to move between the bed and the chair. That goes around the waist, snug but not too snug, keeping mindful of anything that's going on in the abdomen for the patient. Again, I'm squatting because this is a low bed position. I'm going to demonstrate how this is going to work for you. I'll be in front of you with my hands on the safety belt. You're gonna have your hands on my elbows. We're gonna stand together. We're gonna turn, and we're gonna sit down. Okay? All right, hands on my elbows. We're gonna count to 3. We're gonna stand up. 1, 2, 3, on your feet. Very good. Now we're gonna rotate around. Good, the back of the legs are gonna touch the chair. You're gonna put your hands on the chair. As she sits, I'm gonna squat with her, control the momentum by the safety belt. 1, 2, 3. Great. You're doing great. Okay, so we're gonna help you move between this bed and that chair using a walker. How this is gonna work is you're gonna push up with both hands on the bed when the time comes, and then once you come up a bit, the hands go on the walker, and then you're gonna turn until you reach the back of the legs on the chair, and you're gonna sit down. I'm gonna be keeping you safe by the safety belt. I'll have my left hand on your back. I'll be squatting as we start to maintain good body mechanics.
So not starting here?
Correct. All right, so we're gonna count to 3. We're gonna go to stand, and then the hands go to the walker, and do the rest of the way up. I'm gonna put my other hand here on the front of the safety belt, and you're gonna rotate around. I'm staying in a good strong stance with a good straight back. Good, the back of the legs touch the front of the chair, hands on the chair, and I'm gonna squat as she sits. 1, 2, 3. Very good.
So, we are going to be doing a lateral transfer using the maxi tube to transfer a patient from the bed to a stretcher. You want to make sure that the ankles are crossed on the patient, make sure that they cross their arms. This tube is going to be halfway underneath your patient, so that way it bridges the gap, so that way you can transfer them from the bed over to the stretcher seamlessly. Proper body mechanics, you want to make sure that you're bending, all right? At the knees and at the hips, keep your back straight. You are going to push on hips and shoulder to be able to transfer the patient over onto the sliding board. All
And
right.
this bed is slightly lower than the bed that she's on, so that she's going downhill.
Right.
And as the receiver, I'm gonna get ready to receive her. I have a wide base of a stance. My back is nice and straight. Ready?
Mhm.
2, 3. I'm gonna roll her.
And then we're going to
Slide
untuck
that
from the
out.
shoulders and from the ankles and pull it the rest of the way through. And we are going to be doing a lateral transfer with the maxi tube to transfer the patient from the stretcher to the bed. Again, you want to make sure that the heels are crossed and on the maxi tube. You only want it halfway underneath your patient, so that way it bridges the gap in between both transfer surfaces. Make sure that your patient's arms are crossed. The
And
person
I'm
that's
gonna take the squat. I'm gonna keep a low position, wide base of stance, and I'm gonna push at her shoulders and hips. 1, 2, 3.
all right. Once she's transferred over onto the bed, we're going to untuck this from underneath her ankles and from underneath her shoulders, and we're just gonna pull it the rest of the way through.
For this segment, we're going to be instructing you on proper body mechanics during wheelchair transfer. When transporting patients by wheelchair, move forward as much as possible. As we're turning into any doorways or going downhill, we're going to instruct our patient and turn the wheelchair. Go backwards. You can turn, go forward again. Make sure that we are engaging our lock mechanism here. And then you'll be ready to transfer your patient.